I chose Inspira for a few reasons. Number one, this is where my family is and I wanted to settle down. Secondly, it was a community hospital and I really enjoy that type of demographic. It allows you to connect with the patient much more. They also have involved in a lot of education with their residency program, and that was essential for me. I really believe that the people that we train today are going to be the doctors of tomorrow, and I need to pass that on. So in between my undergraduate training and med school, I had actually worked in an ER, and I thought I was going to go into emergency medicine. But during my third year of med school, I had an experience with a patient who had a trauma, and the ER doctor, much respect for that, specialty, but there was nothing he could do, and the vascular surgeon was like, "Let's go," and we ended up saving that woman's life. And I was like, That's what I want to do. I want to be that person that, in that moment, that critical moment, to help someone. And that was the reason I went into medicine to begin with. I experienced a personal loss, and I thought, had I had the tools, could I have made that difference? That's why surgery seemed to fit. I wasn't exactly sure of what specialty I was interested in. It was also fascinating. But during my training, during general, I did fall in love with adrenal surgery and endocrine surgery, thyroid and parathyroid, so, as well as everything else. So. A general surgeon is just that. We operate in general areas of the body. That ranges from soft tissue of the skin, from the breast surgery for cancer or benign disease. It also involves intra-abdominal surgery, so gallbladder, bowel, stomach, colon, as well as lumps, hernias, groin hernias, incisional hernias. Also complex wound care is something we're involved in. There's so much more you could say about general, but that's in a nutshell how I could describe it, I suppose. My approach to patient care is very much, it's individualized. I want to get to know my patient. I want to get to know something unique about them, how many kids they have, what they do for a living, so that when I'm going to operate on them that day, I don't just remember them by their disease. I remember, oh, that's so-and-so. He works in piping, or she has 3 kids and she's a teacher and she has to get this done before school. So that is very important to me. When you think of their personal situation, it also kind of guides and shapes your plan of care for them. I think that's really important. It's very dynamic. Their input is very important to me. So it's not just me telling them this is what they must do, but it's much more of a conversation. My goal is to provide the best operation that I can do possibly, and I aim for the best results.